Hello, everyone, and welcome to today's MinMD Real Talk webinar, Injection Therapy Online Clinic. My name is Austin Hunt, and I'll be your moderator for this event. I work on the marketing team here at MinMD, and I'm excited to be hosting this session today. Also joining the call from MinMD today is Karen Bono. Karen will be joining us to help answer any questions relating to MinMD during the Q&A session. Before we get started, we have a short disclaimer that we need to review.
The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
All right, with that being noted, I'm pleased to introduce today's presenter, Dr. Yana Barbalat. Dr. Barbalat is a fellowship-trained men's sexual health urologist who specializes in erectile dysfunction, ejaculatory dysfunction, low testosterone, incontinence, and male and female voiding dysfunction, and is located in Woburn, Massachusetts. Today, she's going to cover injection medication, syringe and dosing, injection techniques, support options, provide a brief demo, and then hold a live Q&A to close out the webinar. So without any further ado, I'd like to kick things off by launching a few poll questions. How long have you been experiencing ED? All right, we're sharing the results now. Looks like majority are 5 years plus, with 1 to 2 and then 3 to 5 years right after that. So have you ever performed an injection on yourself and not received the desired results? Yes or no? All right, gonna share those results now. Looks like 71% said yes, they have done an injection and did not receive the desired result. Well, hopefully we can fix that today after you're done with the webinar. Last question here. Have you attended one of our previous MinMD Real Talk webinars? Yes or no? So we hold various events throughout the year. We're up to about 5 topics now. And this is by far one of our most popular topics, injection therapy. All right, sharing the results now. It looks like majority have not attended one of our webinars before. So welcome to the event. Those of you who have, welcome back. All right, now Dr. Barbalat, over to you.
All right, cool. So first of all, it's great to be here. My name is Yana Barbalat, and I'm excited to do this talk today. Let me just go. Okay, so today we're going to talk about, as you guys know, intracavernosal injections, or as I like to call them, penile injections. And penile injections are basically used for erectile dysfunction. And they're very often used as sort of the second go-to treatment for men that fail Viagra. Now, you know, the whole world has heard of Viagra, obviously. But Viagra does not always work for all patients. And I see a lot of patients for who Viagra actually does not work. And those are the patients that, you know, where I would recommend penile injection therapy. So let's talk about the erection process just for a little bit of education. So basically, as you guys see, this is the cross section of the penis here. And the penis basically has an area where the urethra is, and then 2 large erectile bodies over here. Now, these erectile bodies are basically made up of arteries that bring blood into the penis, some veins that are around the erectile bodies that surround them, and then muscles in these erectile bodies. And so what happens is when the nerves get stimulated, the nerves release nitric oxide, which is basically this, you know, compound that makes the muscles dilate. As the muscles like relax and dilate, blood flows into the penis, okay? And so when blood flows into the penis, these veins that surround these erectile bodies basically get compressed. So there's all this blood going into the penis and no blood exiting the penis. And when that happens, you get an erection, okay? So that's how erections basically work, by the relaxation of these muscles that surround the arteries, and then all this blood can go into the penis. Now, what happens with erectile dysfunction, basically that process is somehow interrupted, and it can either be due to the nerves being dysfunctional, or the arteries, or the blood basically not flowing in well enough, or the veins not being compressed. And so all of our therapies involve basically helping this process. Now, the medication, how do ED medications work? They basically increase the blood flow to the penis to achieve and maintain an erection that's strong enough for the entirety of the sexual intercourse, okay? And so when we do these injections, that the formula is basically alprostadil, papaverine, and phentolamine. And these are all drugs that are basically involved in dilating the blood vessels. They help these vessels dilate, the arteries dilate, so that blood comes in. And then phentolamine basically prevents them from contracting back up. And so all these medicines, the alprostadil, the papaverine, and the phentolamine that's in the mixture work together to help men achieve the best erection by dilating the arteries and allowing blood to flow in, okay? And they sort of bypass the nerves. Trimix is basically a mixture of all the three ingredients, and bimix is the mixture of papaverine and phentolamine, so only two of the ingredients. And the reason for that is because some men are very sensitive to alprostadil, and they can have some penile pain with the alprostadil. We'll talk about that a little bit later, but that's why there are some patients where we only do the bimix, which is the papaverine and the phentolamine. Now, bimix basically can be bimix number 3, number 4, 302, and 10. You guys, nobody really needs to know this except your doctor. But the point of this slide is basically to show the fact that there are different men need different concentrations of the medicine because different doses work well for different patients. And so when you basically need a very high dose of the medicine, we don't want to be, to have you inject huge volumes of fluid into the penis. We want you to still be injecting small volumes of fluid. And so, for example, bimix number 10 is a lot more concentrated than bimix number 3. And that's so that if you need a higher dose of the medicine, you don't need to inject a high volume. You just inject a very concentrated, amount. So same thing goes for trimix. There's a standard trimix, and then there's the low alprostadil trimix. And again, the low alprostadil trimix is sort of between the standard trimix and the bimix, where you have low amounts of alprostadil in the medicine because of that aching sensation that some men can experience when they use just standard trimix. Now, what do you need for penile injection therapy? Well, basically, the ICI medications are injected into the penis using a very, very small needle. This is like basically a diabetic needle and a diabetic syringe. It's very small. Now, needles can basically vary. They can vary in gauge, so thickness, and also length. And the syringe is basically the plastic part of the whole device, and that's where you draw up the medicine for the injection, okay? Now, your physician, again, you don't have to worry about it because your physician will prescribe the needle and the syringe, and typically it's just a 1 ml syringe, so a very, very small syringe and a very, very tiny needle. Now, this is a little bit confusing, but basically we talk about the ICI medicines sort of in units. So, let's say you need 30 units, or you need 50 units, or you need 20 units. And so doctors very often talk about the medicines in units. But in reality, if somebody tells you that you need 20 units of the medicine, what you're really using is 0.2 mLs, a tiny amount. Or if you need 50 units, then you're using 0.5 mLs of the medicines, or 0.5 cc, sometimes we say. If you need 100 units, then you're using 1 full ml, or 1 cc of the medicine. So starting dose, adjusting, and the whole log process. So basically, the first injection is very typically done in the doctor's office. And that's because we want to determine what is the correct dose. So after you receive your trimix or your bimix, you basically bring it into the doctor. Sometimes the doctor will receive it for you. You come in and we figure out what dose you need. Now, basically, the ideal dose is where you can have a full erection that is about 7 or 9 out of 10 erection. So firm enough for penetration, lasts the duration of sexual intercourse, and then comes down in a reasonable amount of time. You don't want a partial erection, obviously, but you also don't want an erection that will not come down, because that can be actually very, very dangerous to the health of the penis and future erections. Because of this, it's very important for the doctor to determine what the appropriate dose is. And so very often men will come in and let's say I will inject them with 20 units of their trimix, so 0.2 mLs. Then I'll leave the room, come back about 10 minutes later and take a look at their erection. And if their erection is about, an 8 out of 10 erection, and then it comes down in about half an hour, then that's a good dose for that patient, okay? And so what's important here is that when you go home afterwards and you're told what dose to use, it's very important that you do not exceed that maximum prescribed dose without talking to your urologist first, okay? You also don't want to inject more than once every 24 hours, again, unless your doctor said that it's okay. And the last thing is, most doctors recommend that you really don't inject more than 3 to 4 times weekly, because there could be some scar formation from continuous injections. And so if you're injecting too much, again, there could be some scarring in the penis, and we don't want that to happen. Now, it is a good idea to actually log your progress. So you basically, they have a little chart here where it says, date of use. So you put down when you use the medicine, you put down how many units you've injected, how long the erection lasted, and how rigid the erection was. Because it's possible that, let's say you go home and you notice, hey, this erection is actually really not rigid enough. And so rather than going up on the dose by yourself, it's very, very important that you talk to your physician about it first, and that they okay any dose increase that happens. Now, how do you prepare for the injection? It's actually very, very easy. The whole process is easy. A lot of patients are very worried about the idea of penile injections before they've actually seen it happen. And then when they see how the doctor injects the medicine, it's super, super easy. So you want to gather your supplies, prepare the medicine for the injection, and then inject. So gathering the supplies. So what do you need? You basically need your medicine, you need your syringe and your needle. The needle is actually not that big at all. And then you need some alcohol pads. So what do? So let's use 20 units. Let's say you went to your doctor and they said you need 20 units of medicine. So what you basically do is you open up your needle, you uncap the needle, and you take a look at your syringe, you note where the 20 units is. And it's either going to say 20 units on your syringe or it's going to say 0.2 mLs, okay? But what you need is basically 0.2 mLs, which is 20 units. You use the alcohol swab and you swab the rubber part of your medicine container, okay, medicine vial. You swab it so that you keep it clean, and then you take your syringe and you put the needle right into it while it's upside down. And you basically draw up the 20 units of the medicine and no more than that. So the line, the black part of the plunger right here, the very tip has to be at 20 units. Now here they talk about injecting air into the medicine and all that stuff. I don't tell my patients to do that. I just tell them, turn the vial over, draw up your medicine after using a little bit of alcohol on the rubber part of the medicine vial. And then that's ready to go. And then sometimes what I tell patients is tap a little bit, make sure there's no air bubbles in there either. And then you inject the medicine. Now, you have to inject the medicine into these erectile bodies, obviously. And the erectile bodies can be found if you inject the medicine at the 3 o'clock position and the 9 o'clock position of your penis. So your urethra is all the way on the bottom. That's at the 6 o'clock position. So you want to inject either the 3 o'clock position or the 9 o'clock position. And you basically take the syringe and the needle perpendicular to the penis. You go all the way in with the needle and you slowly inject the medicine. And you want to avoid, there are going to be some veins on your penis. You could see the veins, and you want to obviously avoid those veins. And after you've injected the medicine, you basically, remove your needle, and then you push down and hold a little bit of pressure for about a minute or two to make sure that there's no bleeding in the area. What's important here too is that you alternate the sides. So the next time that you inject, it's a good idea to do it on the other side. So if you've done the 3 o'clock position, the next time you want to do the 9 o'clock position. You don't want to inject in exactly the same spot every time, because again, that can lead to scarring. One thing that I forgot to mention is make sure that you clean the skin with alcohol. So it's important to clean the skin with alcohol before injecting. Let the alcohol dry, and then you basically inject. So side effect mitigation. So, it's really important to use proper technique, first of all. And second of all, it's very important that your urologist teaches you how to inject the medicine. And that you're using the correct dose. The dosing is very, very important, and you do not want to overdose on this medicine, because if you overdose on the medicine, a patient can develop priapism, which is a prolonged painful erection where there's basically no circulation of blood in the penis. And that is an emergency and a reason to go to the emergency room. So if you have an erection that lasts for more than 4 hours and it's very painful, that's a reason to go to the ER. So in order to prevent priapisms, it's important to stick with the dose that your doctor basically told you to use, okay? And so you see a urologist for the first dosing. It's important to rotate the injection site, like I said, within that target area so that you're not injecting in the same spot every single time. And it's also important not to use the medicine more than every 24 hours, so at least 24 hours apart. Once you puncture the vial and have used it, it is important to keep the medicine refrigerated. And we usually tell people to really not use it beyond 28 days. So once you've used that vial for 28 days, that has been open for 28 days, you really don't want to use it more than that. Injection accessories help. So there are some, basically travel tools, like a little tote that you can use, and you could put your, all your accessories into. There's an Insules, which helps with, drawing up of the medicine. There's also an auto injector, a Sharps container. MenMD is very, very good about sort of helping the patients with what they need and navigating this whole, process. And so if you guys need any help, you can always call MenMD, or you can, visit the portal and get support through the portal as well. Okay. This is just for more information. This is the number to MenMD. Okay, so now I'm going to basically demonstrate. I just need to get set up here. I am going to demonstrate how to inject the medicine, okay? So basically, here I have the model penis, okay? And I have everything that you would need for the injection. So you have your medicine, either trimix or bimix at the concentration that your doctor ordered it at. You have your alcohol swabs, okay? And you have the syringe. And this is a really great syringe. It's basically like an insulin syringe. It has all the units right on here. I'm just going to show it right here. You see all the units, no mLs, just units. But this is actually a 1 ml syringe. And then the needle here is protected, but it's a tiny, tiny needle right there. So basically, the way that you prepare this is you open up your syringe. You open up the part for the plunger, okay? And you open up your alcohol swab. So again, let's stick to the 20 units. So what I typically do is I clean this area of the vial, okay? Then I turn the vial over and I stick the needle right into the rubber part. There's a little rubber part right here. And you want to stick your needle right in there while holding the vial upside down. And then you basically draw up your 20 units, right there. It's a little bit more here than that. So right there. So you draw up your 20 units, okay? And then you remove your syringe. And if there's any air bubbles, we basically tell people to just kind of tap the syringe to get the air out, and you could push on it a little bit, push the plunger a little bit to get the air out. So I have 20 units here. The next thing that you do is you basically prep the area of the penis. So you want to inject at either, this is the penis, you want to inject either at the 3 o'clock position or the 9 o'clock position. So either here or here, okay? You don't want to inject anywhere on the bottom or all the way on top. But this whole area is safe right here. So you basically prep the area right here. I'm going to pick the 3 o'clock. Then you put the syringe right in, right here. So 3 o'clock position, and then you slowly inject in the medicine, slowly, 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 okay? And then you basically take out your syringe and you put pressure. I just use that alcohol swab to put pressure on the area. So you put pressure on the area for about a minute or two. You could check that there's no bleeding. Let's say there's no bleeding and you're done. And then you can basically stimulate the penis like you would, you know, in any other sexual encounter. So you stimulate the penis and the erection really should come in within like, you know, 5 to 10 minutes. It should come in pretty quick. So that's what you do. That's the demonstration.
All right, I think we're ready to go into the Q&A portion then. So we're going to start off with some side effects and dosing questions here. First question, how do you know what dose to start out with?
So typically we order sort of, you know, the standard trimix solution for most patients. And then you start with a low dose. So for patients that have problems, let's say that are neurological, so spinal cord injury patients or patients that have any neurological disease, we start with a very low dose for those patients. So very often, let's say 10 units or, you know, probably 10 units. For patients that have like arterial issues, so just older men with cardiovascular disease, for those patients, we typically start with a little bit of higher dosing, but you always want to start low and then work your way up, because what will happen is a patient will come in and let's say I'll start with 20 units. I'll come back in and check in about 10 minutes later. They still don't have much of erection. Then I'll add in another 5 units. So you go very, very slow and you kind of give the minimum appropriate dose that you can give a patient, because it's always okay to go up in the future.
All right, next question here. Can you use trimix with Viagra or Cialis?
You know, I think in some cases you can, but really ideally the best thing, I mean, we don't usually mix. Usually the best thing to do is really to just use the trimix at the correct dose that's appropriate, because you can always go up on the concentration of trimix. So, you know, you don't have to use huge volumes. You don't have to use like 2 or 3 mLs of trimix. You just need to use the higher concentration.
All right. Are there any long-term side effects to using injections?
So long-term side effects would be the side effect of scarring of the penis. Sometimes, you know, eventually, let's say as cardiovascular disease and the arteries are less healthy, sometimes trimix will work for a while and then it doesn't work after many years. It's not because your body's tolerant to it, it's just because your arteries may be not, as responsive, or your veins may be leaky. So there could be, just reasons why it may not work after a while. But long-term side effects, the biggest one would be scarring.
All right. Is bruising or swelling at the injection site anything to be worried about?
No, I mean, there really shouldn't be too much bruising or swelling, but if there is a little bit, you shouldn't, as long as it's not getting worse. If this swelling or bruising is getting worse and worse, then that's something that needs to be seen by, a urologist or your primary.
Okay. Next question here is about dosing. We got a bunch of questions kind of similar to this one, so we'll ask this one. I'm up to 40 units and still not good enough for intercourse. Should I keep increasing the dose?
So I think, yes, you can definitely increase the dose. 40 units is not a huge dose, and you may need a higher dose. So I think that's fine to increase it. Again, make sure you check with your doctor that they're okay with it. And then a lot of times when the patients really get higher and higher, 80 units or 90 units, that's where you may want to use just a higher concentration. So your physician may want to write for a higher concentration of the medicine, so that you're not using such high volumes.
All right. Is aching in the penis normal when using trimix? What can I do to stop the aching?
So the aching could be from that alprostadil component. So one of the things I would recommend is you can always use sort of the low alprostadil trimix, and then you can also use bimix.
All right. How frequent can injection therapy used safely?
So I generally recommend that patients use it no more than once a day, and that they don't use it any more than about 3 days a week.
Okay. All right. So I got a question here about medication. I take 3 blood pressure medications. Will that impact my ability to get an erection using injection therapy?
So blood pressure medicine may just basically impact an ability of a man to get erection, and also it just kind of high blood pressure in general can affect erections. So I think you could still use trimix. You could still definitely try it, and hopefully it works. It works for some men. It doesn't work that well for others, but I would definitely give it a try.
All right. And next question here. Why does my injection cause unusual side swelling and my penis will not get fully erect?
Side swelling. I mean, it could be that it's just could be like a bruising, or if you're getting it into a vein, a superficial vein that's there. That's the only thing I could really think of.
All right. Now we're going to get into some technique questions and shelf life. A lot of questions around shelf life for these. First question here, is it always painful after the injection, or am I doing something wrong?
So again, it could be from the alprostadil that you're having pain. It shouldn't really hurt much. The injections, we use a really small needle. It's like a 30 gauge needle that's used, really tiny needle. And it really shouldn't hurt much. So it could be the alprostadil component that's causing the pain at that, in the penis.
All right, got a similar question here. I'm obviously injecting wrong. It burns and forms a sub-Q bubble, which is painful and lasts a long time. What am I doing wrong?
So it could be that you're also not injecting deep enough. So just make sure, here I have the needle. So make sure that you're really injecting basically the whole length of the needle inside like that. So you want to inject all the way in to the hub, and then it really should be, in the erectile tissue. You don't want to be injecting just right underneath the skin. You want to kind of go inside so that you're hitting the erectile tissue. You can't really go too deep, to be honest, because you'll just go from one erectile body to the other. And, I think you could definitely go that deep in.
All right, do you have to avoid visible veins when injecting?
Yes, for sure. Because I mean, the veins have blood in it. So if you're going to get into a vein, it could bleed and cause a hematoma or a bruise, and that can hurt as well.
All right. How far off from the bullseye can you be and still have success?
How far off from the bullseye?
Yeah, I think they're asking if they are outside of the 10 o'clock to 3 o'clock, 2 o'clock range. So if they're erecting in a different spot.
Yeah, so you know, as long as the injection hits the erectile bodies, it needs to go, the erectile bodies are basically like here and like here. So it's just not safe to be in the other places. You know, you don't want to be hitting your urethra, and you don't want to be hitting right on top because there's veins and things like that that go up top here and no erectile bodies. So you want to get into the erectile bodies. You can still have sex, but it's just not really safe to go elsewhere, and it may not be as effective.
Gotcha. All right. So I have a follow-up question about pain. They're wanting to know a couple of techniques to reduce pain after injection. They say, can you ice the site or use numbing cream?
Yeah, I mean, you can use the numbing cream. I would just go, make sure you're not going to the same spot also, because it could be that that area is just more sensitive, a little bit more inflamed, or maybe there's some scar tissue that has formed. So make sure you kind of go to different spots in the penis. So I kind of like to go over here. You could go, you know, you can kind of rotate your spots. And the other thing is, when you inject, make sure you inject very slowly. Don't go fast. Inject very slowly to get it in, so that it doesn't distend the tissue quickly. You know, that's sort of the technique that I tell my patients to use in order to not have a lot of pain with it. But you can ice the area. You can, you know, the penis is pretty resilient, so you can definitely ice the area if it hurts a little bit right after. You can just hold more pressure for a longer amount of time to really kind of, you know, decompress that area. And you could use numbing cream. I don't know how much it's going to help, because I don't think it's that injection site that really hurts. I think it's just the fluid going in and kind of distending the tissue that may hurt. The other thing is that it could be that the volume that you're using is a large volume. So you may want to try a more concentrated solution so that you're using less of the solution.
All right. Next question here. If I routinely don't get erections when injecting, does that mean my technique is bad, or does the medication just not work for me?
The medicine may not work. You know, the technique is pretty simple. So your technique is probably okay. So I would talk to your doctor about, again, increasing the dose, because you really can go up. And the other thing is, some men do have something called venous leak. So, you know, when I was talking about the erections, you know, all that blood flow going into the penis and compressing those veins, it's very important for the veins to be compressed, because then the blood doesn't exit the penis. But if there's a venous leak, the veins are leaky basically. And so while blood is going into the penis, there's blood leaving the penis at the same time. And so men that have venous leak may not do as well with injection therapy. And so that may be what's going on. So I would look into it.
All right. Next question is around combo therapy. Do you recommend a combination use of injection therapy and a vacuum device?
You know, I usually tell patients to kind of stick with one thing. I think it's reasonable to use a vacuum device and the injection therapy because, again, the vacuum will compress. You use usually a vacuum device with a penile ring as well. And that can help the blood flow into the penis and compress it from exiting the penis. So I think it's worth trying. I don't have too many patients that, you know, that do both, but I think, you know, it's reasonable to try.
All right. A follow-up to
Yeah,
the
just
with,
before I'm gonna, for the question before, I would say definitely, again, my disclaimer, definitely check with your doctor about that. However, that your vacuum device is, you know, appropriate and it doesn't, because again, the one side effect that we urologists worry about with injection therapy is priapism, so prolonged erection. So that's the one thing to be careful about. So definitely check with your doctor about that.
all right. And then a follow-up on the VED. If you're using that in conjunction with injection therapy, what's the proper order? Should you inject and then use your VED, or use your VED and then inject? That's a common question we get around the subject.
Interesting. I would probably do the vacuum device and see what kind of erection you get with that, and then use the injection therapy at that point.
All right. I got a question around accessories here. Is there a self-injector device that you would recommend?
So Austin, you may be better.
They say
Yeah.
self-injector. I mean, it's probably auto-injector is what they mean.
Yeah, that's what I'm thinking. You guys have the auto injector, correct?
Yes, we do.
Do you have like a picture of it or a way to share it? I had it in my slideshow.
Yeah, it's on the shop. It's like 3/4 of the way down the left side. It's the Injectee's auto injector. Is that something you would recommend, is using an auto injector, maybe for someone who has trouble injecting or they're a little nervous?
Yeah, I think so. I think that's a good idea.
All right. Next question here. Is there any advantage to injecting on both sides of the penis? So doing half a dose on one side and then half a dose on the other?
You know, I don't think so, because the erectile bodies they communicate too. And so I think it's, you don't really need to do half and half. I mean, for different men, every person is an individual. So if you notice that it works better like that, I think it's totally fine to use like that. But you don't need to do half and half. I think one side is perfectly fine.
All right. We get a lot of questions around beyond use date, so using medication after that, or how to get around that. What happens, here's a question here, what happens if you use the medication after it's don't use after date?
No, I tell my patients not to use it afterwards. It may not work as well. That would be the only concern I would have. I do have some patients that use it, you know, beyond the 28 days, but I don't recommend it because I'm not sure how well the medicine will really work at that point.
Okay. Next question here is kind of an interesting one. Does the injection location or technique for a penis with foreskin differ at all? Do you need to roll back foreskin to inject?
Nope. So the foreskin basically only covers sort of the head of the penis. And I usually tell patients to inject, you know, right here. So definitely not in the head of the penis, but in the erectile bodies that are right here. And so kind of close to the scrotum, over here. So the foreskin really doesn't make a difference.
All right. Next question here is around bruising. How can we prevent bruising? A hard purple thing has to be scary looking for our partner.
So, you know, that's the compression. So after you inject, you basically want to keep compression. That's really the only thing you can do. You also definitely want to avoid any veins in the area, which I'm sure you're already doing. There may just be some bruising despite of that anyway. Unfortunately, I don't really think there's a way to really prevent it completely, just sort of doing certain techniques, but you may still bruise because that erectile tissue is full of blood. And so, and arteries, right? And there's veins all surrounding it. And so, and some of the veins are deeper veins, not just the ones that you see. So there really may not be a perfect way to prevent bruising.
All right, last question in the technique section here. In what body position is it best to inject? Sitting, lying down, or standing?
Doesn't matter, whatever works for you, whatever is comfortable. I often inject men while they're sitting. And so I guess my patients learn to do it while they're sitting so that they could see what they're doing. But whatever works best, it doesn't matter at all.
All right. My hospital provider suggests using a vascular restriction ring with trimix injections. What are your thoughts on this?
I think that's reasonable. Again, for those patients that have a venous leak, that may help because that ring basically keeps the blood from exiting the penis. And so I think that's a reasonable option for patients for who, you know, the trimix doesn't work perfectly.
All right, follow-up question for the venous leak because it's come up a couple times. Is there a way to stop it other than using a ring?
So unfortunately, no, because what happens is the veins are basically leaky. So you want to compress the veins. But, you know, a lot of men that have venous leak, for who, you know, the trimix doesn't work, they may not be candidates for that therapy.
All right, next question here. I have a hernia. Is it safe for me to inject?
Yep.
All right, short and sweet. Can you self-inject if you visibly can't see your penis? I have a large belly. Do you have any suggestions?
I mean, one option would be using a mirror, doing it in the bathroom and using the bathroom mirror combined with, you know, like a portable mirror. Partners can also inject. You know, that's totally fine and encouraged. So something like that. I wouldn't do it blindly because then you can get it into, you know, the area where the urethra is. I wouldn't inject blindly, and you can't see any bruising or bleeding that's going on. But I would use a mirror or have a partner help.
All right, got an interesting question here. Is there a stronger formula than trimix? I recently heard of something called quad mix. What is this, and does MinMD carry it?
I don't know. Do you guys carry it? So I don't usually prescribe it. I know there's super trimix, and super trimix is basically, you know, a term that we use for doing, you know, for the higher concentrations, the other concentrations of trimix. Do you guys have that?
Karen, maybe you can chime in here. Karen, I don't know of anything that we have called mix, but we do have a bunch of different trimix mixtures.
Yeah, I wonder term for that, one of them.
Currently, we do not have a quad mix, but we are always looking to increase our mixes that are available to everybody. So that is something that has been brought up, and our pharmacist is definitely researching that.
Okay, there we go.
Yeah, I have not prescribed that to anybody.
All right, next question here. After injecting, my wife uses a vibrator on me and my erection goes away. Why?
I don't know. Maybe there's a psychological component to it. I'm not sure.
All right, next question here. Will a 6-ounce glass of wine affect performance after injections?
6 ounces? No, it shouldn't. I mean, you know, alcohol in general can affect sexual function, but a little bit of wine should not really affect it too much.
All right. Can Kegel exercises help me get my natural erections back?
I mean, Kegel exercises strengthen the muscles that surround, you know, the penis. Theoretically, they do not. I haven't really heard of that. I don't think so, because the whole erection process is really you know, it happens in the penis. It's the nerves, it's the arteries that are running into the penis, it's the veins. Kegels are really the muscles that surround that anal area and that area underneath the testes. So it shouldn't really, you know, affect erections in any way. But over Kegeling, I will tell you guys, because I see this a lot, over Kegeling can cause painful ejaculation. I have seen that a lot.
Interesting. Next question here. What do I do if I accidentally bend the needle?
I would get a new needle. I wouldn't use a needle that's bent or, broken or anything like that.
Yeah, absolutely. Don't try to straighten that out and reuse it.
No.
All right, next question. How do injections differ from intraurethral gels as far as effectiveness?
So intraurethral gels are pretty effective, but that's just a prostadil, which can cause a lot of penile pain. And so, so that's why many men actually prefer the injections, because they're a lot less painful. What happens when you use the 3 medicines together, then you are actually using a little bit less of each one. And so, and while keeping good efficacy. So that's how they're different. It's more concentrated.
All right, next question here. Are my diabetes meds causing my ED?
Yes, diabetes meds can, diabetes in general can cause ED. And, a lot of different medicines can cause ED also. Most likely it's not really the medicine, but the diabetes that causes ED, because diabetes damages blood vessels and causes them not to expand and contract properly. And so the medicines are important. The medicines that are most responsible for ED are anti-hypertension meds, however, but hypertension itself can also cause ED. So it is important to keep both diabetes and hypertension under control.
All right, I got 2 questions here that are kind of around age. First part of this, is there any age that this therapy is dangerous to use? And the second part is, how safe is this for men in their 70s?
The medicine is safe. There's really no age restriction here, no age cutoffs on either end. And it is safe to use in 70-year-olds, again, as long as you're using the correct dose of the medicine and using it properly.
All right, using Trimix, does the erection remain after you ejaculate?
The erection typically comes down after you ejaculate, because the ejaculation process basically causes a reversal of the whole situation, and the arteries constrict back up.
All right, can injection therapy help to restore occasional spontaneous erections?
No.
All right. Next question here. When the erection lasts more than 3 hours, what's the best action to take? So we actually got a couple of questions here about prolonged erections. One person actually sent in a story that was really interesting, saying that their doctor at the ER told them to go home and just put ice on their erection to make their erection go down. So what do you recommend for erections that last longer than, the 4 hours?
So, I tend to tell patients that they should go to the emergency room at that point, because erection lasting more than 4 hours basically means that there's no circulation of blood in the penis. And so that's very, very dangerous, because all those erectile bodies that are there can become fibrotic, can kind of scar down, and then the medicines won't work in the future at all. So it is important to get help. I wouldn't really do much at home, because then you're just wasting time, essentially, if it doesn't work. There are some doctors that tell patients to take Sudafed and then go to the ER. I just tell patients to go to the ER, and usually what happens in the ER is you get an injection with a certain amount of phenylephrine that goes straight into the penis and tries to bring the injection down. If that doesn't work, then a urologist is typically called to get all that blood out of the penis. So it is important to get straight to the ER so you can get your injection of phenylephrine in the penis.
All right, next question here. Can Bimix be prescribed online? I was already using it and then stopped. I'm looking for an easy way to start back up.
Can it be prescribed online? I mean, I don't think so. I prescribe it typically through you guys, through like a specialty pharmacy. And if you already know what dose you're on and you were using it You just need a physician to basically prescribe it. I would get it from a legit, pharmacy like MedMD. I wouldn't just get it from any website.
Yeah, absolutely. I don't know of an easy way to get it. Everything that I've heard, you have to go speak with a physician to get prescribed.
Yeah.
All right. One more question here. Is there any danger for a partner to perform oral sex after the injection?
No. Mm-mm.
Okie dokie. All right. Moving on to the next question here. I'm not getting enough results for penetration. Some or no results increased to 40 on their syringe dosing. They want to know, if their injections aren't working, should they be looking beyond that?
Again, 40 is not a huge amount. And so I would talk to your doctor about going up on the dose and, to find a dose that works. Because 40 is not a huge dose at all, especially for, a 60 or 70-year-old man that has diabetes or hypertension or any kind of vascular disease. So, so I would go up higher.
All right. I got another person here who says that they have doubled their trimix dose over the past year. They want to know, is it time for them to look into an implant?
I think it's basically a conversation between the physician and patient. At some point, it is time. When your physician says, "Hey, you're already on a high concentration, and we've doubled the dose," I think at some point you start talking about an implant. But I would, and then the other thing that you could do before talking about an implant is get a penile, Doppler, which usually happens. You go to a specialist and they basically inject the penis with, the amount of trimix that you're on. And then they do a study to see the arterial and the venous flow. And then a doctor can tell you, hey, there's a lot of, let's say, venous leaking. And so maybe this is time to go to, to a prosthetic. But sometimes they'll see that there isn't a venous leak, and then maybe you could still go up on the medicine dose because there's just not enough arterial blood flow. So, before talking about a prosthetic, I would consider getting more information as well. That's, I think probably the best option.
All right. Just want to follow up on that Biomix being prescribed online as well. I got a text message from someone saying that who's listening in, so thank you for your help. They say that you can contact MinMD and we can request a Biomix RX from your physician for you. So you can come to us to help you out with that situation as well. All right. Next question here is going to be around ejaculatory dysfunction. Wondering if you can also address the issue of climacturia.
So painful. So that can be, there are many causes for that, but the biggest cause that I see in my patients is some sort of pelvic, I'm not sure if they mean after the injection therapy, but in general, men that have pain with ejaculation, a lot of times it's some sort of pelvic floor pain that happens. So pain in the muscles, testicular pain, things like that when patients ejaculate. I see that a lot.
All right. Got another person here saying that they're on injection therapy and that they're getting plenty of erections, but they're going 70+ minutes without ejaculating. They want to know what you'd suggest to help them get across the finish line.
I mean, it could be that, so no orgasm, I'm assuming. They're just,
Yeah.
could be that the dose is high as well. That's another thing that I'm just thinking about. Could be medicines that the patient is on. I would look into that as well, because some medicines can basically make a man not ejaculate for a long time, not have an orgasm for a long time. So that could be a cause too. Antidepressants are very common culprits for that.
All right. Final question here, and then we'll go ahead and wrap up the event. We're at the 8 o'clock mark right now. So this person is asking about Peyronie's disease. They say they have a lot of scar tissue built up from injections. They say, since my penis is very small, I'm running out of viable injection sites. What do you recommend?
You know, unfortunately, a lot of times with Peyronie's disease, if there's a lot of scarring, patients need surgery, whether it's prosthetic or surgery to correct the scarring. So I can't really recommend much as far as, you know, troubleshooting, you know, injection therapy. A lot of times at that point, you need some sort of surgical approach to correct the scar tissue.
Okay. All right. With that, I'd like to thank Dr. Barbalat for taking the time to present today. And we'd also like to thank everyone listening in for attending this MinMD Real Talk webinar. We hope it was informative and that you'll join us again in the future. If you'd like to learn more about injection therapy, you have a few options. As I mentioned in the introduction, we've attached the injection therapy guide to this event. If you'd like, you may download the PDF for your reference later. Again, that's going to be in the Handouts tab in the Control tab. There are also more resources in the Resource Center on minimd.com. Visit this page to view instructional videos, guides, expert articles, and more. We also have a very good article on there by one of our pharmacists that goes over the 28-day rule. We had a lot of questions come in about you know, how long their medication would be effective for, and that will cover just about everyone's question on that. So next here we have, you can also call MinMD at 857-233-5837, or you can log into the password protected secure MinMD portal to schedule a free appointment with a MinMD clinical case manager. If you don't have a specialist for your sexual or urinary tract health, MinMD has a new physician finder service. Go to minmd.com and click find a physician in the top right corner to go ahead and get started. If you're interested in injection accessories, you can learn more or purchase accessories on the shop page in the MinMD portal, or by calling into our office at 857-233-5837. We'll also be sending a follow-up email with references to helpful resources and links to each after the event. I'd like to thank everyone again for attending today's webinar, and we'll see you at the next one.